So first of all, can you share with us about the process of ExoDerm? How did it come about?
We've commercialized our E50 skin booster around 2000, end of 2020, beginning of 2021, and we're in about 20 plus countries. And of course, with the introduction of E50H with Nexo Hair, it was only natural that we roll out our skin with facial care. And to be honest, I think, especially for facial care, the combination is perfect because here especially they're focused on a lot of non-invasive procedures, whether it's needling, peeling, or energy-based treatments. All of it usually involves causing some sort of trauma and allowing the natural wound healing process to achieve your anti-aging or rejuvenation goals. And of course, again, that has to do with our cells. And our E50 skin is all about reprogramming our cells so that they can behave a little bit younger. So I'm 36, so hopefully I can make it behave 28. And then when we do these treatments like Potenza or peeling, if our cells are younger, then we'll see faster results, better outcome, less downtime. Right?
It's groundbreaking. But is it safe to say it's like the holy grail for?
I mean, to say it out of my mouth is a little bit embarrassing, but I think yes, not just E50, but I think the whole segment of exosomes very promising in the realm of therapeutics for diagnostics and drug delivery. Of course, we're tapping into the very, very small part of that, but I think the future of therapeutics is definitely with exosomes.
How different is it from other microneedling procedures like Potenza?
Well, our standard ExoDerm procedure is done using a handheld microneedling device. So, of course, many users have experienced a microneedling facial. However, what stands out is that it's very superficial. So we use a device that's very soft, meaning the RPMs are very low compared to your traditional devices, microneedling pens that are more higher RPM, meaning more needling in a given amount of time. And also, more importantly, we are trying to focus on the superficial layer of the skin, 0.3 to 0.5 millimeters, meaning, again, no downtime, minimal pain, especially for the immediate response from patients.
Who are the best candidates for the procedure? Is there a specific age range you would recommend?
There really isn't. I think it can benefit anyone from starting from 18 all the way through a senior patient. Because again, as we age, of course, our cells have aged, and we didn't have melasma when we were younger, right? And again, because we get melasma because our melanocytes have gotten older, and now because of that aging, the machinery is aged, so now it's preventing producing unwanted levels of melanin. Right? This is how we get melasma, pigments, and such. So again, by reprogramming our cells to behave younger, we can achieve more hydration, regression of pigments, treat laxity and things like that. But again, that's for older patients. But for an 18-year-old, you can use it as a preventative measure. Right? Yes, it's much easier to prevent aging than it is to reverse aging. So now using these type of therapeutics, now we can slow down aging. Meaning maybe if I started when I was 18, now instead of 36, maybe my cells can be 30. Is the idea.
It's like the idea of any kind of skincare. But anyway, in which country did you introduce this first?
I would say our phase 1 countries are UK, Australia, Spain. I'm American, so although my place of business is in Asia, coincidentally, most of my initial launches were in Europe or in the Western countries. We're definitely the number 1 brand in places like Australia and England, and we've been doing quite well in those.
The reason why I asked because, of course, in European countries, the skin type of there's a different skin type compared to
Absolutely.
to Asia.
So again, I think that's a fair point because not only
So
different
just
races.
one, you see this one? This
Yeah.
one is European.
Yeah.
So in Asian, we are not common this one,
Mhm.
but as Caucasian, very common is fine winkle, is many winkles. Even those young, under the 50, they have many winkles.
Mhm.
So that's why we are using this
Excellent.
one in the Europe.
However, but Filipinos have problems with what? PIH, right? Whether it's acne, right? And then you'll have acne spots, or a lot of times, of course, these lasers are great for resurfacing, but there's very limited use here in the Philippines because again, they're great, but you will get PIH afterwards, right? Now using E50 in conjunction with these devices, now you can properly treat acne scars and things with devices like fractional CO2 lasers and taking them to the proper endpoint without risking dangerous side effects like PIH.
Speaking of that, how soon can one undergo laser procedures after getting ExoDerm?
So minimum, I would give minimum about 2 weeks
Mm,
for the effects of the ExoDerm to
I
really
see.
take effect and update the cellular machinery so they can actually respond better.
Alright.
And usually, if a budget wasn't an issue, if you were to do energy-based treatment, Potenza, for instance, I would do ExoDerm first, maybe 2-3 weeks ahead. Like you prime your skin before you put on makeup for an event. Right? You will most likely put on a face mask, hydrate your skin the night before,
see.
put on a primer and apply makeup. Similar concept. And then after your Potenza's treatment, apply another application of ExoDerm topically, E50, and that'll help reduce downtime and of course accelerate the wound healing, produce more collagen.
And so, just to be clear about that, sorry.
Yes.
There are topical products after the procedure.
Yes, so
you
for
can avail.
instance, our Nexoderm using the handheld microneedling, the Nexoderm facial is using a handheld microneedling device. But for instance, after a Revlite or Potenza,
I
we
see.
would just, since the microchannels are already open, we would use a device called Target Cool, which is a spray device that you might have seen in some of their promotional content, and we'll just deliver the exosomes
I
using
see,
that
I see.
device. Yes.
Thank you.
So after undergoing the procedure, when can the patient or the client go back for? Would there be any touch-up, something like that?
With this type of treatment, no, there will not be a touch-up or anything. It's just another session, depending on when they would like to do it, either a month after or 3 weeks after. Or...
Weekly isn't recommended.
No, actually, weekly is too
Too
soon.
much, I see.
I would say minimum give it 2 to 3 weeks
2 to
in
3
between
weeks.
sessions.
Because we have to waiting for this collagen.
Yeah.
Yeah.
Because it's 1 week's not enough to produce new collagen. Minimum is 2-3 weeks. It's fully developed collagen, and then we try again. That's better.
And the effect will last for how long?
So we have some long-term follow-ups that we did up to 2 years.
Wow.
And again, of course, it's not trying to promote, do it once every 2 years.
Yeah.
But for study purposes, we have some cases that we followed up. Actually, the one with the red face everywhere that you'll see, the Korean lady actually, is an 18-month follow-up, but we followed her up to 2 years. We treated her only twice, on day 1 and week 3.
Is it easier to treat Asian skin compared to Caucasians?
Really depends.
Really depends.
This lady is 18 months. Is rosacea.
How old is she?
She is 45 something. Yeah. Because she has 2 kids. One is a high school student. Is something 18, 17 something. Another one is 15. So two kids.
But in regards to what you mentioned, I think more than race, it really depends from person to person.
And
Different wishes.
I see. As skin authorities, what major skin rules do you live by? Are there major tips you wanna?
Well, first, cleansing. I think cleansing thoroughly and frequently is important. Using the right products that fit your skin type. I think, of course, a good sun protection. That's very important. Some sort of serum to, of course, give nutrients, provide antioxidants for your skin that again meets your skin type. And then lastly, hydration. A good moisturizer to make sure that your skin stays hydrated. And lastly, something like an ExoDerm that's regenerative, that can really kickstart and reprogram some of the aging that has occurred at the cellular level that you can't really address using just topical serum products.
Thank you.
Sorry, what do you think about, I mean, there are a lot of trending skincare routines that are like
10
100
steps, yeah.
and
10
what do you
steps.
think of those?
I always mention that if you need something, just get a cleanser, toner, and a serum. And then, of course, most Filipinos and Filipinas will wear a sun protection.
Yes.
Right? So if you do those two things well, keep it simple so you can do it frequently and you can do it anywhere.
Have you ever think about cleansing is 3 different products simultaneously?
Yeah.
Never, right? So cleansing is the most important because it's most of you, except you, is only the cleansing is 1 time or 2 times maximum. But is I highly recommend cleansing is the first liquid type. Second is
Powder
granular
type.
granular type.
Granular, right?
Third is foam type.
cleanser.
Meaning is 1
Triple.
time. Yeah,
Triple
Yeah,
cleansing.
only is cleansing. Also, without any treatment, also is make skin is not easily the aging because there's many. Now the environment is not like the before. Environment many air pollution, sun damage, many things, but is make totally clean the skin and then more frequently using the sunblock is that is the most important. That is prevent, but it's ExoDerm different way. ExoDerm regeneration. So that's why we recommend the prevent. How can I say it's
Well,
slow
the
the
cleansing
aging.
and sun is prevention, right? The antioxidants and nutrients is maintenance. But just because you prevent and maintain, you still age. So and then something like an ExoDerm will be anti-aging, right? So the combination of the three.
Triple combination.
Thank you.
Well, for my last question, how do you think ExoDerm will, change the skin regeneration game in the Philippines?
For me, I think what I notice in Filipinas mostly than Filipinos, I've done more than most Filipinas, is largely 3 things. They're either sort of on this complexion, lighter, where they'll have a lot of telangiectasia, rosacea, or they might be, I think, a little bit darker to, I think, your complexion, a lot of pigments, PIH. And then there's the darker skin, where their skin's very thick, large pores, dry.
I see.
Right? And all those things that I mentioned, you can address that at the cellular level, right? Right? Right?
Yes.
The dryness is the keratinocytes, right? The PIH, again, is from the melanocytes, right? So we can address those things, and I'd like to see that. And cosmetically speaking, I think what I notice a lot also are ExoDerm facial covers the lips also. Something that I noticed in all Filipinas, a lot of you have this morphology where the lips sort of roll in. And it rolls in, and the color of mostly women do. The top lip also, the
Dark.
color is totally different than the bottom.
Yeah.
Yeah.
Just
Right.
like my
And the border, of course,
serum.
because it's rolled in, is not distinct.
Yeah.
And usually when the lip edges aren't distinct, it's not sexy, right? And I think just even the lips alone,
Yeah.
it makes a big change. Out of confidence.
Yeah.
Disappeared pigmentation is around
Exactly.
the lips,
Oh.
especially dark skin more commonly. So maybe if you can, you just follow my Instagram. There are
Yes.
many cases, even though lip too.
Yeah.
Make a treatment to lip is lip is more is foolish, even though disappear the discolorization.
then more medically, of course, I think he and I always enjoy helping, you know, people that have autoimmune disorders, inflammatory conditions, especially children, right? I hear here in facial care, many dads will bring their daughters for laser hair removal because they'll be bullied in school.
Yeah.
Same thing applies to acne, right?
Yes.
Inflammatory conditions, right? Kids in adolescence, right, might be bullied for that. And I think helping them so that they can have more
that's
confidence
nice.
would be nice, right?
Yes,
Regardless
yes,
of all the commercial points, I think
Yeah.
helping people
Yes.
That is my
the
point.
core of
Yeah,
medicine,
yeah.
right? So I think that'd be nice.
Thank you so
Thank you
much.
very
Thank you very much.
감사합니다.
Thank you so much. Thank you.